And out pops the genie and grants him a wish. The guy says, I want to go to Hawaii, but I hate planes and I'm scared of boats. Build me a highway from here to there so I can go. The genie said, are you nuts? Do you realize what kind of time it would take to drive pilings into the Pacific Ocean? Or the amount of concrete and asphalt it would take to lay 2,000 miles of highway? Or the workforce it would take to accomplish a job like that? And the guy says, okay. Instead, why don't you just explain the Affordable Care Act to me? And the genie paused and says, were you thinking of a one-lane highway or a two? As Kit asked me this week for the title of my presentation, first off, I don't know why I needed to give a title for about a 10 to 12 minute presentation, but it was called Mapping the Course Together. And I'll explain what that means in just a little while. But I was thinking, how was I going to come at this presentation this morning? Was I going to wear the hat of a provider or an employer? Because I serve on our benefits committee and I represent one of the largest employers in the county. And we've been struggling with many of the decisions I'm sure you guys have been struggling with for literally months. We've been wrestling with the impact, the financial impact of healthcare reform on our organization. And I wanted to share one thing with you, or a couple of things with you. In 2010, one of the first provisions that we all had to comply with was covering dependents between the ages of 19 and 26. For Northeast Georgia Health System, since 2010, that one provision has cost us $3.1 million. I also asked for some more updated statistics. In the first 6 months of this year, the cost to cover the required women's preventive services has cost us around $650,000. These are just direct costs that hit our bottom line, and we have no ability to impact those. So I can tell by this packed house, you guys are here for the same reasons we are. I'm going to be taking notes the rest of the morning when I finish up, and I hope to learn a lot too. Ultimately, I decided to wear the hat of a healthcare provider, though, because I'm real excited about a couple of initiatives going on in this community. And this morning, I want to talk to you about 3 of those, and then I'm going to wind up and turn it over to Rich Sanders. The first is something we're calling employer engagement. A while back, it became real clear to us that we needed to strengthen our relationships with employers. As we negotiate our managed care contracts at the health system, those can oftentimes get in the weeds, and you're up at the last minute trying to figure out whether the health system or your physicians are going to be in and out of network. Well, we realized that if we had a better relationship and open lines of communications with our local employers, that we might be able to mitigate some of that risk before it really happened. So our plan for this will be to begin constructing employer focus groups. We might start off with 2 or 3 initially, and we want to put 10 to 12 business reps on those so that we can meet on a routine basis to discuss the issues affecting this local community and the healthcare needs of it. We also want to do some one-on-one, more thought-provoking meetings where you're able to invite your insurance payer, your broker, or a provider of service to talk specifically about the needs that might be affecting you. And we also want to continue to support great events like this and also the Chamber's Healthcare Committee. And we participate that on a monthly basis, so we're always there. One of the other things that we've learned, and we worked with an outside firm, is that oftentimes the vernacular that we use as healthcare providers is very confusing to business community. I don't know of any industry in the world that uses more acronyms than healthcare. Everything is a 3-letter abbreviation. And we've got to remember that as we relay our messages to you, that we're not speaking in terms you don't understand. We really need to understand what your needs are so that we can ingrain that into the way we communicate. The second thing I wanted to talk about is our managed care strategy. And I'm just going to briefly touch on this, but I think these are tools you guys might be able to use as you make decisions over the coming years. It's obviously we know that you guys access health care in a number of ways. Many of you are going to stay with your group health policy with Blue Cross, Cigna, Aetna, United, or any of the major carriers. So we know that we need to be a provider of service in those networks. It's our goal to stay in good standings with these contracts and to try to negotiate fair and equitable deals. But we know from feedback that you guys get in a bind when a negotiation is kind of getting into a tenuous spot and you may not know whether we're in or out of network. So one of the things we've tried to start incorporating, and Shannon Glover and Tony Herdner at our camp do this, is we've negotiated longer-term multi-year deals, 3- and 4-year deals with these payers. What that does is you don't have to worry about every 12 months wondering whether we're going to be in your network or not. The other thing that we've done is we've tried to stagger the terms of these major commercial payers, so we don't have Blue Cross, Cigna, and United all hitting in the same year. We actually try to stagger those out so that we're not doing those but once every so often. It might surprise you to know, too, that these negotiations have become so complex and so detailed with financial modeling and contract language review that we sometimes start preparing for a negotiation with a contract 12 months ahead of schedule. And to give you an example, in 2014, third quarter of 2014, our contract with Blue Cross Blue Shield is set to expire. We're going to assemble a team in January to start preparing for a third quarter expiration. So a lot of planning, a lot of prep work will go into that, and we're going to set out what we feel like is a reasonable timetable for that negotiation so that we can communicate with you and give you plenty of time to make decisions or plan changes if necessary. And you're going to be hearing more about that as we go. Second area under our managed care strategy I want to talk about is our Health Partners Network. It currently has 650 physicians in 6 regional hospitals. The hospital has used this network for over 10 years for its own health plan. But this is a way for large self-insured employers to contract directly with their healthcare providers and eliminate the middleman. And this doesn't work for everyone. This model is typically designed for larger employers, but it's a way that you can take your healthcare into your own hands, come up with creative plan designs, pay your own claims, and keep your claims funds in your own bank account. And we have that resource available to businesses in this region that want to take advantage of it. And as David alluded to, we currently serve over 40,000 members in Northeast Georgia, and we rank 3rd in market share to Blue Cross and United. The last thing I wanted to tell you about, and unfortunately I hate to say, we probably know just about as much of exchanges as you guys do, but we are participating in the exchange plans. And we want to support that strategy because we know many of the individuals in this market and the uninsured will be accessing health care through the exchanges. We're currently a participant in the Alliant Health Plan Exchange, which is one of the 5 that were approved in the state of Georgia. And we're also working with Humana and Blue Cross, and we hope that we're going to be in those networks when they roll out later this year. And we're in those discussions now. So we do want to support the exchange strategy, but it's still a little unclear how that's going to look in this market. And I'm actually hoping to learn a little bit more about that from Commissioner Hudgens this morning. The last thing I wanted to discuss before I close is the collaboration that's going on in this local market between physicians and hospitals. Many of you may not even be aware of this, but one of the challenges for providers with healthcare reform is that we've got to be able to improve the outcomes and the quality for the patients we serve at a lower cost. We're in an environment called fee-for-service, which means if a physician or a hospital bills a service, they expect to be paid for that service. It doesn't really matter whether it's an appropriate service or whether it's been, we've had 3 of the same service done in the same week, we get paid. And that's flawed. There's a lot of waste and duplication in our healthcare system today. In a new environment called a value-based purchasing system, we have to be able to say, is this care that we're about to bill a claim for appropriate? Do we need to have multiple MRIs on the same patient if it's within a month of the procedure? And the answer is probably no. So the way we do that is we start looking at evidence-based protocols for how we practice medicine. And we follow these national standards. And we actually have some pilots going on in this community right now where physicians and hospitals are working around things such as diabetes and appropriate emergency department utilization to see if we can streamline the way we do business that gets the patient the best outcome and also lowers costs for all those involved. You might sound, well, that sounds too good to be true. How are you going to improve quality and lower cost? Well, I'll tell you, the first thing we have to do is we have to continue to get physicians and hospitals connected. And here's my first acronym of the morning, Health Information Exchange, or an HIE. We are currently connecting electronic medical record systems together throughout a 23-county region. What that would allow you as a patient to do is see your results online, communicate with your physician online, order prescription refills, anything like that. With your permission, it would also give the ability to, if you had a CT scan done at a primary care visit, it would allow you to share that electronically with the specialist the following week without having to have a duplicate test. That type of connectivity is really going to go a long ways in solving the problem of the rising healthcare crisis that we're in now. And we're real excited about that collaboration, and you're going to hear a lot more about that in days to come. But the focus of all of these projects is patient-centered care. It's got to focus on the outcomes and improving the quality for the patients we serve first, and we hope that the cost will follow. Well, I chose the title, Mapping the Course Together. I truly believe that our effort has to be one where we work together and we openly communicate about the issues affecting all the stakeholders in this. We don't have all the answers, and I know you don't have them either, but together we might be able to rise to this challenge. So that's why I chose that title. And I'm going to leave you with a quote. And the quote, it's a Chinese proverb. It says, "When the winds of change blow, some build walls, but others build windmills." And I want to build windmills in this community, and I hope you'll join me in that. Thank you.